All right, so we're just going to perform task number 19, which is just performing a cross match. I have my friend Sky here, who is a 10-year-old female spayed canine corgi mix, and she is going to be the recipient for the blood work today. I have my assistant who's just going to restrain her, and I'm going to get some blood from her jugular vein. So I have my 3cc syringe with a 22 gauge needle already attached. I have some alcohol, and I have my lavender top EDTA tube already labeled with the patient's name, species, and date. So my assistant's going to go ahead and hold on to her head and restrain her so I can get some blood just from her jugular vein. So we're just first going to put my finger in the jugular groove and press down to feel the vein. We're going to spray with a little alcohol. Okay. We're going to take the cap off of my needle, pull back on the plunger to make sure that we're not sticking anywhere, and we're going to go bevel up into the jugular vein. Good girl. And I'm going to get a full 3 cc's. Good girl. I'm going to hold off. My assistant's just going to hold where I had the needle in her vein. I'm going to do the one-hand approach to get my cap back onto my needle. I'm going to remove the needle. I'm going to remove the cap and just gently put my blood sample into the tube because I just don't want to damage any of my blood cells. Okay, then we're just going to put the cap back on, and then we're just going to invert it 4 to 6 times just to make sure that our sample gets thoroughly mixed with the EDTA so that we don't have any clotting. Alright, so we are nice and mixed. We're not clotted at all. And I'm just going to grab my pen real quick. And we're also just going to label on her tube that already has her name, her species, and the date. Just want to make sure that I make a note that she will be the recipient after the cross match. Okay, I'm just going to check her neck just to make sure we don't have any hematomas or anything. Oh, good girl, Mama. Okay, so she's good. We'll get her back in her cage, and I'll be back in a moment just with my second patient who will be the potential donor for the cross match. And that is just the first part of performing a cross match.